Thank you, Mr. Chairman. And I actually agree with that notion about the senior citizens. I would first of all like to thank AARP because I've not always agreed on some issues, but I respect the work that is done. The folks back home provide lots of energy and activity. I, for one, am sorry that you're subjected to something of this nature because I truly think reading through a 25-and-a-half-page pamphlet with 243 footnotes to try and dress it up to make it look official and authoritative and scholarly misses the mark. I find it fascinating on page 17. You are taken to task because somehow you are undermining your long-term business interests because you have underwriting standards that are more flexible and speak to the needs of people who are 50 to 64 that cost potentially some money. And you're taken to task for that. Well, you supported the Affordable Care Act, which now requires every American to have these protections, which you undertook at perhaps some financial disadvantage to your model because you thought it was the right thing. I remember that when some members of Congress who used to support helping seniors with end-of-life care, when the big lie about death panels and they retreated, AARP was part of 400 individuals and groups that came forward to tell the truth. Now, just because somebody, like my friend from Georgia, thinks something is in the bill, doesn't put it in the bill. And I appreciate your zeroing in. This report takes you to task because AARP had the audacity to support the Children's Health Program expansion. Assuming you did that only for some sort of convoluted financial benefit, ignoring the fact that your members have children and grandchildren and great-grandchildren, and we all want intergenerational cooperation. Mr. Chairman, I've read it. I think it's a little bit goofy. With all due respect, the notion somehow that they focus on Medicare Advantage that is rocky and is a draconian cut. Medicare Advantage means that 75% of your members who are senior citizens in fee-for-service pay $90 a year more. So maybe trying to reform Medicare Advantage speaks to the 75% of your members and 75% of America's seniors who are paying more because a system got out of hand.
You have expressed our rationale.
I just think that I'm glad it's in the record. I hope people look at it. Witch hunt is such a nasty term. I look forward to bringing before us people who have really crossed the line, people have commingled funds and pushed the limits or crossed over them in terms of IRS regulations. But I think any fair reading is that your work on pre-existing conditions, children's health, end of life, Medicare reform, speaks to what we need to be doing as a country and as a Congress. Sadly, this morning's exercise moves us no further along towards the implementation, but the things that you came out for back in the day used to be bipartisan supported. And someday they will again. I appreciate your efforts. Again, I apologize for being a part of this, but I do hope people analyze this and understand that it's no indictment of AARP. It does say something about this committee's operation. Thank you, and I yield back.